So components of the e-prescribing screen, hopefully everybody's getting pretty familiar with this. Um, I think the screen is pretty straightforward. I don't think it's as easy as the other PANDA screens that we've actually developed as well as technology, but I do feel like this is pretty straightforward. You know, you're always going to see your patient information on the left-hand side. Drug allergies are going to appear below that. Coverage details, which we're hoping are going to appear on, you know, the majority of clients, but that information does come from the pharmacy database. And then the pharmacy being here on the bottom. I know I've talked about, you know, trying to get those pharmacies entered in. I think you guys only use ValueMed, so hopefully you can just get in there and enter ValueMed for everybody so that they're ready to go for go live. Patients' active medications are always going to appear on the top. Inactive medications always going to appear on the bottom. So the big pieces of this, we always got to talk about meaningful use because it just seems to be everywhere we turn within the system and the functionality. For CPOE, there's two components for this. There is CPOE and e-prescribing. So CPOE requires 60% of med orders to be entered into PANDA. I know I've said this before, I feel like this is a pretty easy one to meet. Even if you print a prescription, it still counts for CPOE. So I know you guys work a lot with the outside clinic. When you guys are getting medication orders from the outside clinic, I recommend that you enter those in as detailed, reported, using this button here, which is what we're going to use prior to go live. Then it's not linked to either Dr. Smith or Dr. Murthy, but it can appear on the MAR, which it sounds like it needs to if you guys are going to pass those meds while the client is at or in placement at the residential. So I feel like that one's we're going to knock that one out the park. I just feel really confident about that one. E-prescribing, 50% of prescriptions need to be sent electronically. I really hope over time everybody feels that that's a really easy process, that you're not having to worry about printing, but 50%, you know, that's only half. So I feel like that is very achievable also. But both of those meaningful use components are really only going to occur in this screen, in the e-prescribing screen. So please be aware of that because it is two separate objectives that we're able to cover through this component. Nurses have been set up as proxy users. You guys can enter in all the medications, you just can't send it to the pharmacy. I mean, that's really the number one thing to remember. This is a workflow change. Please be aware of that. Hopefully with PANDA being accessible on phones and tablets and easy to get to, that it won't be, you know, an issue for the docs to get in and be able to just approve the medication. But I know that is a workflow change. So I know you guys have been talking about that and preparing for that, so just to be aware that everybody's on the same page with that. I'm actually going to start this training with the patient-reported medications because we're using this for pre-go live data entry. So this should be used for all medications going into PANDA before May 1st. I know I've said that you guys don't have to print your MARs out of PANDA for May 1st if that's not what's best or most convenient for you. We do hope that after May 1st, all the MARs are going to come out of PANDA, but my understanding from talking to a lot of the sites is that they're usually printed even the night before, so April 30th that evening, so there's no reason to have to wait until go live to get those printed. So there's two ways to add patient-reported medications. The add patient-reported, I honestly haven't come up with a scenario that this would apply to for the residential sites, just because with the add patient-reported, you're really only able to add just the name of the medication. I know at Mingus, they prescribe, I don't even know if it's prescribed, but they pass herbal medications to their clients there. So we talked about putting those through here because if I put in an herbal, we'll just make up something, herbal medication, the medication is not found by the system, but it will add it to the patient's active medication list. So because it's not found in the system, it does not do drug-drug interaction checks, but as I said, you can add it to the active medication list, which will make it appear on the MAR. So we definitely need to be working with Mingus on what their approach is going to be, because I have looked up some of the medications that they use, the herbal medications, and they are not in the system. So I could see this being the approach for that, but otherwise it's just such vague information that you can put into this screen. I don't anticipate you guys using that a lot. The add detail reported is going to be used frequently. This allows us to actually search the database for the medication. Let's do We'll just do Ativan. It allows me to search for the medication. I can pick the dose that's most appropriate that the client is taking. I can document when they started this medication and then the actual details of the med. Dispense, I don't think that's as important of a field because you guys are not tracking pill count through the e-prescribing screen in PANDA. If you did want to note refills that are still available, I think that makes sense, or the day's supply. So through the add detailed reported, you can enter in pre-go live medications or any outside medications. If a client comes back from a specialist and has medication they're supposed to take for 7 days, you'd want to enter it in as add detailed reported. Anybody have questions about that component since you guys kind of are doing that for pre-go live? All right, good. The one thing I really like about that, because initially, can someone please mute their line? I'm not exactly sure who it is, but I hear just a little background noise. One thing I was concerned about when we initially started talking about the pre-go live meds was that the docs were going to have to be involved. So this approach removes the docs from having to be involved. Nothing is sent to the pharmacy. It is basically just added to the patient's active medication list so that it can be added to the MAR and available to be administered to the client. All right, so adding in, oh yeah, go ahead.
So when we're putting the meds on the e-prescribing, I know Sue's going to have to go in there and reconcile the medication list. Do we have to go back in then and edit and put the times for it? Because we're putting, take 1 tab daily, but it's not putting like 0800 or something like that. So once the meds are reconciled by Sue, do we need to go in and edit and add the times that we give them then?
So that piece is totally going to be handled under the medication dispense times functionality. So you won't actually go into the e-prescribing piece. You'll go into here, I'll add my medication. I'll select my medication from the drop-down because these are going to be all the ones that are have been entered into e-prescribing. I do want to note that there is a little bit of a delay between communication in the e-prescribing screen and PANDA. Currently, we have to run a script behind the scene, and basically it's called an API call. We call the e-prescribing company and say, hey, give us the most updated information. The workaround for that is in process, the developers actually suggested it, which I thought was awesome, is that they want to add a sync medications button. And we talked about adding it to this section here and also adding it to the internal medical encounter medication section. Because if Dr. Smith goes and enters a medication into e-prescribing and goes back to the internal medication encounter, that medication is not instantly there because the system has to call the e-prescribing and get that information back. So the plan is to have a sync button available so that Dr. Smith could just hit that sync button and it will pull the medications immediately for that patient that she's seeing at that time or documenting on at that time. So just do be aware of that because you're looking here, that medication I just entered, that Ativan, is not on the list yet. It just hasn't been pulled back from the e-prescribing. I recommended, if you guys are printing MARs out of PANDA for May 1st, that you get the medications entered in at a minimum by the 30th and you print them on the 1st. That will give the system obviously plenty of time. Or you enter them in and then an hour later you go in, or 20 minutes later, or whatever works best for you guys. But it's not instant. And I did not mention that in the provider training, so I definitely wanted to get that out there so everybody's understanding that the system is working, but there is a little bit of a delay. So when I come in here, I would add my medication. So this really is a two-step process for you guys. The medications have to be entered into e-prescribing, then you're creating your MAR. I don't know if you guys have as stringent requirements on consent forms for medications as Mingus does. Maybe you guys totally do. But this was actually initially created for them because the concern was if I enter a medication on the e-prescribing screen, I don't want it to automatically appear on the MAR because I may not have gotten consent from the guardian until 2 weeks later. So that's why this middle ground was created so that you guys can determine exactly what times you want the medication dispensed, which I remember for the last implementation, everybody kind of had a different schedule for when they pass meds, which that caused some struggles. But then I can come in here and say, he's going to get it at 7 o'clock. Yes, I want to make sure that there's a signature box available for the client. I have received guardian consent. And then you can put your start date on when you want the medication to start being passed. And with the guardian consent, we did talk about adding a not needed field, but I ran that past Marianne, and Marianne, you on the line, do you want to explain that? Because your wording was a lot better than what I know I'm going to come up with.
Yeah. For the antibiotics and stuff that you guys provide them as part of, their basic health care regimen when they get sick and stuff, even though you might not have to obtain a consent on the spot for the antibiotics, technically consent was obtained upon admission with the parent, guardian, worker, whomever consented to medical treatment. And so in those instances, you would click yes.
Perfect. Does that make sense, Jamie?
Yes, it does. Thank you.
Okay. And I know, like I said, that is a two-step process. There really isn't a way, with the e-prescribing, we send a prescription to ValueMed or Walgreens or whatever. When we put in patient instructions, we don't determine the dispense time, so there was really no way to put that in that system, have it go to the pharmacy, and then have it appear on the MAR. So you really are just building the MARs from scratch based on what's available in the e-prescribing section. So I know the initial work up front is going to be time consuming, but over time, hoping that, I know medications do change, so I'm not saying that, but over time I feel like that it'll become a familiar process and you won't have to make those updates all the time. You can add new ones or remove or whatever is needed so that the MARs are up to date. How often do you guys update your MARs? Is that really frequently, or?
It could be, on a daily basis, depending on who they saw, but, the main thing is, in the middle of the month, we'll go through and double check everything to make sure they're current with the current one. So it will be fine. We didn't know, I guess, how to get the times on there, so that answered that. Thank you.
Okay. Daisha, did you have a question? I can't make you the presenter because it impacts my recording that I'm doing right now of this training. Okay, it must have been a mistake somewhere, error. Let me know if you guys need anything or just holler. Okay, so adding a new prescription, very similar process to adding a detailed reported, but the big difference is obviously this is going to go to the pharmacy, or you're going to print the script and send it to the pharmacy. So I'm just going to use my add new prescription button. I really encourage you guys to create my favorites. I was kind of disappointed though, because I thought that the favorites were available in the detailed reported medication functionality, and they're not. I wish that they were. I've actually put in that request to the e-prescribing company, but that doesn't mean that they're always going to jump on that and get that done for me. But the My Favorites is always accessible when you're creating a new prescription. If you have docs on site that order, medications frequently, the same types of medications, or the docs are in that situation where they're entering medications in and they're frequently ordering, similar medications for patients, this functionality is super helpful, and you really, you can just click on this and it's going to take you almost to the end of the process where you can just send the prescription. So let's do, got so many on my list already. I didn't even know albuterol came in a tablet form. See, I'm always learning something new with this. I'm just going to say use as directed since I don't waste time on that. If you need to, also note that there is other items available. If I just wanted to get a certain number of inhalers, you can change that there. There's a lot of items available. I think the system will automatically default to something that's going to correspond to the dose and form, but if needed, there is a large list of different forms for dispensing that are available. Day supply is not required, totally optional. If you want to enter some notes to the pharmacy, you can do that here. There is a note in your manual about titration medications. I don't know how frequently we use that, but somebody did ask me about that. The plan is either if they need to be directed to the patient, then you're going to definitely want to put them in the patient directions You know, take one tablet for the first 3 days, take a half tablet for the next how many days. If you need to give directions for titration to the pharmacy, you're always going to want to put them here. There may be situations where you want to put instruction in both the patient directions and the pharmacy notes if it's something that's more complicated type of dosing. You can see right now that my formulary status is working. This albuterol form is not covered by this plan, this PBMA plan that Fred Jockey is on, and it does give me different options if I want to go with a different option. Let me just select one of those. So you'll notice that as soon as I selected that, now I have a preferred level 1 formulary status. This is covered by the patient's insurance, and it's going to give me the exact details of the cost for that patient. So I do think that functionality is pretty helpful. I'm not sure exactly how your guys' pharmacy billing and all that stuff go. I know you guys work with Medicaid and the MCOs, so I'm not sure if that's something that's really going to be as helpful. Hopefully it will be, though. Let's just do 100. And we'll just save my prescription. From here, you can always see the pharmacy that it's going to go to, so it's always going to appear above the medications that you're getting ready to send to the pharmacy. When I'm ready to send it, I just click on the checkbox, I'll enter my PIN, and I'll hit the approve and send. If I need to print it, I can hit approve and print. If I've made an error, I can hit edit and go back and make any edits that I need to that prescription. All right. Prescribing controlled substances. Let's walk through one of those. So same process in the beginning. Let's do, I don't know my controlled substances as well as I should. Oh, I know one that has come up out of Florida that they were concerned wasn't able to be, you know what, I'm spelling it wrong. There it is, Vyvanse. So I did talk to the e-prescribing company because Florida had some docs that were just like, there's no way. You know, there's no way we can prescribe electronically all controlled substances. And DoseBot told me that you can prescribe any controlled substance from a level 2 to 5. So that really includes almost everything based on my understanding. Dr. Sue, chime in if there's anything beyond level 5 that we order or that you ever order could be impacted by that.
No, that's, and that was news to me until I read your packet. I didn't realize that you could do e-prescribing in all states except for Montana and, was it Vermont?
I think it is.
I was not aware that changed. So I'm real excited about this.
I think that it is going to save time, you know, just with having to deal with the paper scripts and sign-in scripts and going through those things. Also getting that script to the pharmacy, since you can't just fax them a script for a controlled substance. The effective date is always going to be required for a controlled substance. I did call almost every pharmacy that SQL works with. Let me tell you, that was not my favorite task in this project, to see if they accept the electronic prescribing of controlled substances. ValueMed definitely does. The pharmacies at Mingus definitely did. There was a few pharmacies that some of our smaller sites use, you know, smaller hometown type of pharmacies, even Clarinda. They're in a situation where their pharmacy that they work with does not accept controlled substances. Some of them just haven't caught up to that. It's my understanding it's about 85% that are currently set up to accept electronic controlled substance prescriptions. So I was definitely happy to see that the Mingus and Woodward pharmacies did accept that. So you do have to enter in a few more details with this. You always got to put in the day's supply. You'll notice that it says Schedule 2 here, so it is telling you it's a controlled substance. I am not set up to electronically prescribe controlled substances since I'm not a doctor, which just probably makes a lot of sense. So it's going to ask me to print my controlled substance. I do want to refer to, let's see, what page is this? This is page 13 in your manual. I did put a screenshot in there. So once you hit approve and send, you're going to get this pop-up that's basically controlled substance ready to sign. It's going to give the doc's name at the top. and your information. It's going to say the patient. It's going to tell you again what medication you're prescribing, the exact SIG, dispense details, everything about that medication. So when you get that screen, you're just going to click that ready to sign, put in your PIN, and then you're going to use that security code that is available through that VIP Access app. So you are going to want to make sure that when you are prescribing controlled substances that you have that handy. That number lasts for 30 seconds. That code is a 30-second code, which is kind of a cool functionality. I do like, even though the EPCS process and getting through the DEA process, you're doing a lot of steps and they're asking for a lot of personal information, which is always kind of terrifying when you're dealing with things on the computer and putting in personal information. But I think that they really have covered their bases well to make sure that this cannot be abused. You have the credential, you have your own app, you're linking everything together, you have a PIN, you got to get a code that changes every 30 seconds. The chances of that being abused or getting into the hands of the wrong person and having all those pieces of information is just nearly zero. I'm sure somewhere there's some situation that's occurred, but I just was really impressed with all the detail with that and all the requirements. Even though I know it's a little bit of a hassle to double check and get that code number, it definitely protects you as a provider to make sure that nobody else is entering controlled substances under your name. One note I do have in here, and this may apply to docs that are going to be likely to want to prescribe medications through their phone if they're out and about or need to approve a medication. For controlled substances, I cannot approve a controlled substances on my iPhone and look up my VIP access token or security code on the same iPhone. It will not let you do that. It is a DEA regulation. So if you're trying to order something, you cannot order it on your phone and use the app from your phone at the same time. They've just made that rule, and you won't be able to access DoseSpot from that phone if you're trying to access the VIP app. So please just make a note of that. Printing prescriptions, I think the one thing I do want to note in this section, it's obvious that you'll just hit the approve and print button instead of hitting the approve and send button. But the first time you do this, so what happens, here let me show you, we'll just hit approve and print here. Once I hit approve and print, it's going to launch another internet page. It gives me an extra tab here at the top, and it's going to have my prescription here. You can see all the details on it. Your signature line is here. If you want no substitutions, you would document that here. It's also going to have your NPI number, your DEA number on the top of the script. When you do this the first time, and we tested this, thankfully Marianne uses Firefox. I usually use Chrome. Amber tested it with Internet Explorer. But you will get a pop-up block sometimes, especially that first time. I had switched browsers and I got a pop-up block. So please be aware the first time. I think the sneakiest one was probably Google Chrome's because they just had this little bitty X over a box in the upper right-hand corner. I almost missed it. So please just be aware of that. If you don't suddenly open a new internet page, look for your pop-up block. A lot of times you're going to see something up in the corner over here. Internet Explorer, you'll get the pop-up block here, but just be aware of that because I don't want people thinking, oh my gosh, it's not working or it didn't happen the way it was supposed to, because it will be pop-up blocked. And then you always want to select the choice that says always allow pop-ups from DoseSpot such and such, such and such, because then you'll only have to deal with that one time. So just be aware of that the first time you print a prescription, that your system may just block it. I know pop-up block is pretty common because nobody wants to have a whole bunch of pop-ups when you're trying to do things on the internet. So from here, I think the best bet is to hit your right-click on it and hit print. That way you're going to be able to choose what printer it's going to. You do need to make sure that the tamper-resistant prescription paper is in your printer. I know at Woodward we talked about getting 2 printers for you guys, one for prescription paper and one for just basic printing on a PANDA, whether it's a lab result or a lab requisition or any sort of document. But for the prescriptions, you just double check before you print it to make sure that you are using the tamper resistant paper. If not, I'm in Chrome, but I would just hit change. I would search for a different printer, select my printer, and then I would move forward. I'm not going to print this moment. Oh, stay logged in. So you will notice that you do have the reprint prescription option. If for some reason, say it doesn't print correctly, or it does accidentally print on white paper versus the tamper-resistant RX paper, you can reprint prescriptions. There are a couple rules with this though. The reprint prescription link can be used to print a second copy if it has not been sent to the pharmacy. So I can see right here with my green checkbox, this one that I've chosen, which I can't even pronounce now, has been sent electronically to the pharmacy. So it's not going to let me print this prescription now. It's already on its way to the pharmacy. If I need to make an adjustment to that, you're going to need to contact the pharmacy since it's probably already there and they may already be working on it based on how busy they are at this moment. Ones that have the printer, you can print, but you cannot reprint a controlled substance. So let's say this Vyvanse that it did not print correctly. It printed on the wrong paper. What I would need to do is I would really need to start over. I would remove this medication. I would say it's a mistake. And I would go through the process to add that prescription again from the beginning. I know that that is not a very simple process. It is time consuming. So I think that the best part is to try to avoid that at all costs by double checking to make sure you're using the right paper, and if at all possible, prescribe it electronically so you don't have to worry about the paper. So I would need to just re-enter this order from the beginning, and then it will allow me, to approve and print or approve and send, and you can start from the beginning. If you try to print a controlled substance through the reprint functionality, it will say on there in big print, copy not for dispensing, and a pharmacy will definitely not accept that. So reprint works for non-controlled. Reprint does not work for controlled, so just please be aware. The remove and reorder functionality, I feel like this is super helpful. I'm hoping you guys find it the same so that you guys don't have to re-enter medications once the refills run out or they just need an additional order. You can just click on that order button. This one's going to ask for my dispense information. The one I selected, I should have noted that, was one of the detailed reported medications that was probably entered in before go live. But it will allow me to order that. Oh, let me just choose capsule since it's right there. It will allow me to order that through that order button. So hopefully that saves some time through going through the beginning process. Oh, it seems like it's searching for formulary right now. I'm going to cancel out of there. For the prescriptions, if I hit reorder, it will take me to the main order screen. I apologize if something's delaying it. Somebody got a question?
Yeah, this is Sue. I had a question. I just noticed when we were looking at what you write, do we need to add route ourselves then when we write, like Vyvanse 50 milligrams, take 1 tablet by mouth each morning? There's no route, no drop-down box for route.
There is.
It just goes under patient directions.
Yes, ma'am.
Okay. That's fine.
Yep, I think that anything including the route would go in the patient directions box. And initially, I know in the previous implementation when I was having experience with that system with regards to the e-prescribing component, they had a lot of different drop-downs where you would select this and then you'd select this and then you'd select the route, and there was a lot of drop-downs, and I honestly felt like I was having to do a lot more work. But I think it's just going to be personal preference. I do feel like it's probably a little bit more streamlined just to be able to enter all the information into the one box that's going to print directly onto the patient label for that medication. But I have seen systems that do have, the different drop downs for the route and the dose and how many to dispense, where there's a lot more different fields to update. All right, so you'll notice, let me go back one. Thank you for your question, Dr. Smith. I appreciate it. So once I hit this reorder button, it immediately put that medication here. So if I want to edit it, I can, but I don't really, if I don't need to change any of the details, all you would need to do is have the doc put their PIN in and hit approve and send for it to go to the pharmacy. It won't take you back to that patient details screen. For the detailed reported medications, since they haven't been ordered and sent to the pharmacy previously, it is going to take you to that patient directions screen. It's going to want you to double check and verify that information since it has never technically been sent to the pharmacy through the system. The remove functionality, just really quick, there's 3 options here. Completed and discontinued both have boxes that they're asking for additional information. Obviously, it's up to you what you want to put in there and how detailed you want to be. But go ahead and put in some details if the therapy is completed with that med or it's discontinued. These 2 options are going to move that medication from the active medication list to the inactive medication list. So completed and discontinued both move them from active to inactive. The duplicate or mistake, this will remove it completely from the patient's chart. It will not appear on any of the patient's medication list. So please just be aware of that if you guys are making any updates or removing medication for any reason or discontinuing it, just that duplicate and mistake will remove it completely from the from the patient's chart. Trying to think. Completed. I'm just going to go ahead. So now it's just going to appear down here at the bottom. With that reactivate functionality, the one I just removed was a patient-reported medication, so I didn't get that reactivate as an option. If I remove this medication prescribed and sent to the pharmacy or printed to send to the pharmacy, I'm just going to put done in here. I know we're going to put remove all matching medications, remove all matching medications. I didn't even know I had put multiple items on there. Okay, so let's talk briefly about the pending prescription since that functionality is going to be used quite a bit. We talked about this early in the call, but I know some folks have joined since we started talking about this. Just to reiterate, when you first log into the system, if you are a proxy user, you will get a pop-up that says, who are you entering medications on behalf of? You will only have the docs at your site in that drop-down. So please be aware of that. If you're entering a medication that is a patient-reported medication, so if it's just patient-reported or it's detailed reported, which is the functionality we're using for pre-go live medications, that does not link it to that provider. The only reason they're asking you to select a provider from the beginning is if I'm entering prescriptions in for Dr. Murthy, the system needs to know that Dr. Murthy should have pending prescriptions when I'm done. So that is where that linkage is the most important. If you're entering in new scripts, you want to make sure if I'm entering scripts for Dr. Smith, I need to make sure I'm selecting Dr. Smith. Otherwise, she is not going to get the pending prescription option when she logs into her e-prescribing screen. All the pending scripts are here. I think the most common reason for this is when a proxy user enters a medication in and it's just waiting for the doc's signature. There may be situations where the doc is entering a med and they get interrupted and they have to go do something else and they need to come back. That would also be listed as a pending prescription. So anything that's been entered but not sent to the pharmacy is pending. So let's pick Ping Panda. We'll view the details on this pending prescription. So I have this medication, it's waiting, it needs to be sent to the pharmacy. So all I would need to do is select the medication, put my PIN in, and hit approve and print because I am not set up to send medications electronically to the pharmacy that are controlled substances. So no matter which one you click on, it's going to just give you the details. It's going to take you to that patient's e-prescribing chart, and it's going to tell you what medication is waiting for approval. So I do feel like that is really straightforward. Transmission errors happen in less than 1% of e-scripts, which I was very thankful to hear, because I know as soon as you start talking about transmission errors, people start getting a little bit anxious about how this should be managed or handled. Basically, it occurs when a prescription is sent electronically to the pharmacy, but for some specific reason, the prescription could not be sent successful, and they do try to send it 3 times. There could be communication problems. There could be issues with the pharmacy's phone number in the system. It could be a varying number of things. I do feel that since you guys work with the same pharmacies a lot, that you're much less likely to encounter this. But there is no resend functionality for these transmission errors. So I can choose to ignore it. If I choose to ignore it, it's asking me for a reason. This is obviously coming because I'm not connected to a pharmacy. I'm in a sandbox environment, it's a test environment. So it's going to ask you why you're going to ignore it, which is good, I think, because we definitely don't want to be ignoring transmission errors. If you need to see the details on it, I would click View Details. I'm going to see my medication here at the top, and it's going to give me the option to print it. So with the transmission errors, you can print the prescription, you could call the pharmacy, or you could try to send it electronically again. So there is 3 options with that. It's really up to you how you guys want to proceed with any sort of transmission errors. I apologize because I do not have any refill requests in my system just because we're working on the sandbox, so please follow along with this section on page 19 of your training manual. So refill requests are going to file in the same place. You're just going to have another option that says refill request on the top. It would probably be in this top section is where I'm thinking I remember it being. So refill requests, and I'm not sure how this is going to work with the residential sites, because if you guys are entering in medications and keeping track of it, you may just be reordering it and not having to get refill requests. When I think of refill requests, I think of a patient showing up to the pharmacy and saying, hey, I need a refill of this. So then the pharmacy puts in a request or calls the doctor. So with this, it's going to be interesting if you guys do use this functionality or not, but I will walk through it just to make sure everybody understands. Obviously, the doctors on the line definitely want to be aware of this functionality. So with the refill request, it's going to have the same thing. So I would click on View Details. It's going to take me to that refill request. It's going to allow me to accept or deny. Once, if I hit accept, it's going to give me the number of refills to approve. And then I'm also going to get a little pop-up box that says, enter any optional comments if you want. You do not have to enter any comments into that box, but it will make you select how many refills you want to approve on that request. If you deny the request, it gives you a large list of reasons why you denied. It could be, maybe it's a patient that's unknown to the provider. Maybe the patient needs to come in for an appointment prior to having this refill given again. So select whatever is most appropriate from that list, and then again you'll get that similar pop-up box that says, it's optional. If you want to put in some comments, you can put in some comments. So I did ask, and Marianne actually brought this up, so if you deny a refill request, does that mean it's like just denied for good? Will it come again? And when I talked to DoseBot about that, they said it really depends on the reason that you chose for it to be denied. If it's something where, hey, they shouldn't even be asking for this request for 7 more days, then it's likely that patient's going to come back in 7 days and say, hey, I want a refill request. So you could receive that same request again. It will be dependent on what selection is chose for why the request was denied. All right, so let's talk about medication favorite list. We touched on that a little bit. I think this is pretty straightforward also. If I'm ordering a medication, I'm just going to do whatever comes up first when I'm choosing. Dispense 30 refills. So the one thing I like about this is you don't have to create your favorites list ahead of time. I have worked with some EMRs that you had to, get the list from the doc, and then we would create the favorites list. But this really puts the doc in complete control, or the proxy user who is entering prescriptions for the doc. You basically just have to hit this star. You hit the star, you save the prescription. It's going to give you a little pop-up, what do you want to call this list of your favorites? So I'm just going to have it be the name of the medication and So that prescription's been added. If I want to add another new prescription, you're going to see my new favorite right on the top. If I decide over time, you know what, I don't even barely order that very often, I could just remove that really easy. It is going to ask me to confirm that I want to remove it. So you really can create your own favorites list over time through that process. Anybody have questions on anything that I covered? Do you guys want me to talk about the drug interactions and drug allergy checks? I do feel like we did cover that, but I didn't know if anybody had questions on those items. Y'all are pretty quiet out there. All right, since everybody's being so quiet, I'll just run through a couple more things. If you need to add drug allergies, you're going to use the View Details Edit under the Drug Allergies section. Just going to hit that link. No known allergies is documented here on the top. To add a new drug allergy, I just click on that bright orange button. I do like that they made those buttons bright orange because they're easy to find. Let's say this patient is allergic to Tylenol. It is going to give you a whole lot of options of Tylenol. Let's just do extra strength. The date cannot be unknown within DoseSpot, so please just be aware of that and do your best to select a date that's most appropriate for that patient. If over time I want to edit that, I can. I could say that I made a mistake and this is not even accurate. I would just delete by hitting that delete button and it disappears immediately. Patient's preferred pharmacy, very easy to add. Let me search today for value. Well, you know what? I can't search for value med. I apologize because this is a test environment and I'm not connected to any live pharmacies. I was going to see if that was in there, but I know it is. So I recommend you enter the name of the pharmacy or part of the name and then the state. And I think that for Mingus and Woodward that will locate the pharmacy that you're looking for. If you want to limit it more, just put additional information. If you know the street name that it's on, put the street name in. In good old Iowa, we have a lot of Hy-Vees around. I'm not sure if anybody, I don't think remember having those in Arizona. But I would just select my pharmacy. You can see I have multiple pharmacies over here. If I decide, you know, I only want one, I definitely feel like it's easier to have one since you don't have to select the pharmacy once you get to that final step. But you can add multiple pharmacies if needed. I talked a little bit about drug formulary already when we went through. We talked about the pharmacy. Well, I am at, the one thing I haven't talked about, medication history. So just so everybody's clear on this, medication history is going to be able to be available for probably about 80% of patients. It is all based on the coverage details. So if you're seeing coverage details for your patient, then you can see that patient's medication history. Medication history is always going to be at the far bottom of the screen. You do need to document that the patient has given consent, which Marianne is working with the sites to make sure we got everything in place for consents for PANDA, for the portal, for all those items. So we just check that box and hit that show medication history button. It is going to show medications that have been filled by this insurance for the last 2 years. So it should be a pretty detailed list, and hopefully that's helpful over time that you can see what medications patients have been on. I'm at the Go Live support section. Go ahead, I'm sorry, I didn't hear you.
Sorry. I said that may be my new favorite part of PANDA, is knowing what medications the kids have been on for the last.
Yeah, that is a big deal. I could definitely see that, especially when you have clients that come from all over the place and you don't really know exactly where they've been and what they've been on and how many docs they've seen. And I do think that functionality is going to be awesome. I'm glad that you like that. I think one thing I immediately thought of with the medication history is, I hate that my brain goes here, but I have been in situations where I worked with docs that worked with a lot of drug seekers, and I know there's a huge epidemic in our country with you know, controlled substances, with Vicodin, with Oxycontin. I mean, there's just so many issues. It's just unbelievable the stuff that you hear on the news and in the paper. But this, I think, is a really good safety feature because you can see if a patient has been going to doc trying to get medications, or if they've been getting this prescription prescribed to them frequently along those lines too. So I think that functionality is going to be it's going to be good for a lot of reasons. Who else has questions? I'm at the end of my training manual. I know I don't need to talk about go live support and all that with you guys because you guys have been on several calls and training meetings, and I do really appreciate your guys' time and you guys coming to some of these optional trainings. I know it's been a lot of a time commitment, to get trained and get familiar with PANDA, and I do feel like it's really going to pay off for those of you that have taken the time, out of your schedules to attend these.
Hey, Katie, I did have a question. Is there any way we can, like all of our kids use ValueMed Pharmacy and Coraville. Do we have to enter that every time, or is there a way we can just save it for every kid, so we just enter it once?
I asked about that, and unfortunately there's not a way to enter it for every kid at one time.
Okay, that's fine. Thank you.
That is a great question, though. And I thought about you guys when I asked that question. Who else? Anybody else have questions about e-prescribing, medications, drug interactions, anything along those lines? All right, well, I do appreciate your time very much. You guys know where to find me if you have questions, and I hope you guys have a great weekend.